This is Joe's Corner 76. I will be commenting on the human condition. In order to change it, we have to be engaged. Health, how to get it, and how to keep it. What is the definition of good health? The World Health Organization came up with the following definition that is generally used today. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This appears to be the ideal situation we all should want to be in. 3 questions arise from the definition of health. Do you honestly feel you can give a positive answer and say, yes, I've achieved this state of health? I'm not in this state of health, and if I want to get somewhere close to this state, I have to make life changes. What are the causes of poor health, and what do we need to change to improve our health, and who's responsible for the state of our well-being? I'll tell you who's responsible for the state of your health. You. The decisions you make about diet, exercise, relationships, drugs, sleep, your occupation, and the stress you come under with your lifestyle all contribute to your state of health. Let's examine some of the things that directly affect our life. First, we need to believe that health is the opposite of disease. Health means the safety of the body from physical, mental, and social disorders. It is the thing that helps us perform our daily life tasks. Diet. What is a healthy diet? A healthy diet includes foods like fruits, vegetables, whole grains, legumes, lean meat, and fish. This type of diet can extend your life by significantly reducing the risk from chronic diseases, which are the leading causes of death. What is the North American diet really like? It's said that the standard North American diet is heavily in saturated fats, partially hydrogenated oil, refined carbohydrates, and highly processed foods. We eat too much junk food that is unhealthy. We are tempted every day by advertising this food. Our kids are targeted in the advertising. They tell us how easy it is to get. You don't have to get up off your ass. We'll bring it right to your door. You can continue sitting and watching TV or playing your video games. What does this do to us? We are living sedentary lives, eating supersized calorie-loaded food that is far in excess of our actual requirements. We are not exercising enough. In 2019, 27.7% of the Canadian population was obese. In the US, 2 out of 3 are obese. Canada is on track to getting there. Here are some of the diseases obesity can cause, and they show us why it's such a killer that increases our mortality. High blood pressure, problems with our cholesterol levels, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, osteoarthritis, and some types of cancer. Maybe you should think about that Big Mac and fries. By altering your dietary habits, you can save our lives. What other factors can affect our health? Exercise. The health benefits of regular exercise and physical activity are hard to ignore. Everyone benefits from exercise, regardless of age, sex, or physical disability. Some of the benefits of exercise are: helps prevent extra weight and can keep it off, prevents or helps certain health conditions such as high blood pressure, boosts good cholesterol, decreases our heart disease, stroke, type 2 diabetes, and certain types of cancer, and more. Boosts your energy level. It improves your mood, promotes better sleep, and improves the spark in your sex life. Social factors can affect your health. Social things that determine our health are the conditions where we live, learn, work, and play. These conditions can influence the health and well-being of you and your community, such as education level, the violence you're exposed to, the way your community is designed, and if you have access to health care. These things affect your ability to take part in healthy behavior, and this affects your health. Education. Your education levels can have an effect on your health. Education helps you make better decisions about your health. People with higher education are more likely to live longer. They participate in healthy activities like eating and exercise. They are less likely to participate in unhealthy activities like smoking. Education tends to lead to higher paying jobs with health benefits and healthy or working conditions. Income. The amount you make affects your health. People with higher incomes tend to live longer and are healthier than those with lower incomes. They are more likely to live in safe neighborhoods, have more access to healthy foods, and more access to safe spaces for exercising and other activities. People with lower incomes are more likely to live in communities of poverty where they have unsafe housing, challenges in getting healthy food, and less time for exercise and physical activity. A lower income can affect your ability to have private health care to cover drugs, vision care, dental, and other benefits not covered by government plans. Housing, where you live, can affect your health. People who live in poor conditions are exposed to situations such as pest, mold, structural problems, and toxins in the house that can affect your health. Neighborhood conditions can affect your health. One where it is free from violence, crime, and pollution gives you a safe place for physical activities. Access to health care. Having clinics close enough to you so that the expense of transportation to them is not a financial burden. Having access to a private health plan that will cover many things government plans don't cover, like glasses, drugs, dental, and many more. Things to consider. First and foremost, you are the person ultimately responsible for your health. How you handle these health factors affecting your health will determine the state of your health. We have covered a few of the factors affecting your health, but to highlight things that affect your health. Access to clean water, the social and physical environment in early childhood will determine how you grow and your health conditions. Ethnicity and culture. The health profession needs to be aware of cultural differences that could get in the way of providing health care. Family and social support will affect your health outcome. Gender can be a factor. Medicine has sometimes given preference to women over men in certain areas. Language, communication, occupation, and job security can affect your health. Social status. How integrated or isolated are you? Social stresses such as violence, loneliness, and other stresses. Social and economic status, as well as religion, have effects on your health. All of the factors affect your health every day. You need to understand these factors that affect your health so that you can take steps to improve your health. Remember, you are the one who ultimately controls your health. What are your thoughts? Let me know. You can follow me on Facebook, Twitter, and Instagram at Joe's Corner 76. You can hear me on Anchor FM, Apple Podcasts, Spotify, Google Podcasts, Breaker, and YouTube at Joe's Corner 76.